Okay. Renal calculi. What does the word calculi mean?
Stones.
Stone. So we put renal in front of it, and it's a kidney stone. What are the other name for kidney stones? Don't look at your papers. Thank you.
I saw it already.
Damn it. Like we already did gallstones, right? What are gallstones called? Cholelithiasis. So the term lithiasis means stone. So nephrolithiasis are kidney stones. So it's kidney stones, renal calculi, nephrolithiasis. It all means the same thing. All right. So there are 1, 2, 3, 4, 5 different types of stones with different risk factors for each one. Yay. Okay, so y'all can look at your papers for this because this is a lot of content. All right. Calcium oxalate is the most common type of stones. This is from excess calcium. Okay. Y'all need to know that they are the most common. Okay. Or hyperoxaluria. What are oxalates? Hello, anyone?
I do not know.
I don't know.
I feel like we probably do know.
Yeah, I mean,
Yeah.
I feel like we talked about oxalates at some point. Okay, so they're waste products, right, that we usually get from like tea party food. Like, you know, when you go to like a baby shower or something, and you have like spinach and like, you know, they have little like things of nuts and like little pies, you know, like it's like the really cutesy, like,
So everything I eat.
yeah, like rhubarb pie and like, you know, it's like cutesy baby shower food. Anyway, so that's it. All right, calcium phosphate stones. Now these are usually from hyperparathyroidism. So they are still from excess calcium, right? Because in hyperparathyroidism, the parathyroid is pulling calcium out of the bone and putting it in the blood. Okay, so but those are two separate ones. There's calcium oxalate and then there's calcium phosphate. Are we clear?
Yeah.
Okay. Struvite stones. These are from excess bacteria that come together to form a stone. That's gross. So these would be usually in women who get frequent UTIs. So there's constantly like, you know, there's like sediment in the urine. Have you ever seen that in a urine cup? Okay, so all that sediment will bind together into a big giant bacteria stone.
Gross.
It is kind of yucky. All right. Uric acid stones. Those are self-explanatory, right? Those are patients who have gout. Or if they have very acidic urine, it happens more often in the Jewish population. So if you see that and you go to UTMB, you probably ought to highlight that. Okay. And then there's something called cystine stones, and those are from a genetic disorder that don't allow you to break down cystine. Okay. I'll cover that more in a bit. Okay. Okay. Who's most at risk for kidney stones? Well, if you have too high a calcium, right? We know your body will bind together all the calcium and form a stone. Y'all knew this, yes? There's family history, very common. If you have a urinary obstruction, it is common for you to get stones because your urine can't go through, so all that calcium that's in the urine will just bind up into stones. Yeah?
Yep.
For whatever reason, warm climates are really big into this on a select all that applies. I mean, it's not like you're going to be like, oh, I got a kidney stone, I need to move to Minnesota, you know. Like, I don't know why that's important to them, but for some reason it is. Why would sedentary lifestyle be a risk factor? If you don't get up and move, neither does your pee-pee, right? So as you get up and you like move, it can actually like move your urine and move your blood so things don't just sit. Yeah? If you get frequent UTIs, what type of stone will you be more at risk of?
You have
The
to-
S1. The S.
You have to say the words.
Struvite.
Very good. High protein diet. Y'all know protein is notoriously hard on the kidneys, yes? Okay. A high oxalate diet. Guess what stone that would put you at risk of? Calcium oxalate. Okay, there are some genetic factors, okay, if you have too high of a calcium diet, but this would have to be like a huge amount of calcium. Like you're taking a multivitamin and all you eat is dairy, and then you have those energy drinks that have multivitamins, and like that's what we usually see, okay? Because your body's real good at getting rid of calcium. Now, your kidneys don't normally get rid of calcium. That's not one of our three, right? But your kidneys are always like, you know, the one that's there for you. Yeah, so if the calcium gets too high, they're like, that's fine, I'll spill some for you. Okay. If your fluid intake is not high enough, or you have lots of sodas or juice, why would that put you at risk of stones?
Because you're not flushing it out.
Your urine is more thick, it's more viscous, and it's just sitting there. Yeah? Okay. Next. So, signs and symptoms. This is highly testable and select all that apply questions. Okay. You need to know the adjectives of how they describe the pain. You will hear them say it is acute renal colic, colicky pain, very important for kidney stones. Okay. And it hurts like hell. Like grown men will come in crying because it hurts so bad. And they try to say it's worse than labor. But what would they know? No offense. Sorry, but give me a break. Okay. Anyhow, they will have flank pain because where's your kidneys?
On the back.
In your back. Way up high in your back, right?
Yep.
Way up here. Okay. And highlight radiates to the groin. This is the only type of back pain that will radiate to the groin because what goes to your groin? The ureters and then the urethra, right? So that's why it'll radiate down to the groin, and that's in men and women, okay? It's possible they might have an increased BUN and creatinine, but I want to be very clear this is not an AKI. So you're not going to see all these signs and symptoms. Are we clear?
Yes.
Now, can kidney stones cause an AKI? Yes. They would be what type of cause?
Post-renal.
That would be a post-renal, right? So it is possible, but you won't see that at first. Now, they come in such acute pain. They are puking. They have a high fever. They feel horrible. Severe pain, vomiting, just bad, right? They have a hard time voiding because, there's a giant-ass stone up in there. Yeah? Okay. It is possible that they could have hematuria, which means blood because they're pushing that pressure is going to be pushing really hard to get the stones out. What is pyuria? Pus in the urine. Now, it is also possible that they could have a coexisting UTI with a kidney stone, right? Because if you have a stone in one side of the ureters, then the urine doesn't come down, and any urine that just sits is going to get infected. It could also be down in the urethra, right? Now, please keep in mind that pyelo and kidney stones look almost identical in their presentation and can't both be present at the same time. So you have to rule them both out, okay? So they're obviously, they're going to complain of some abdominal pain, and then there may be some oliguria. This is not significant because this is not an AKI, but it is lower than normal urine output. Because your other side usually is working fine. Wherever you have the stone, that one's the side that's giving us a hard time. They will have CV. What is that?
Isn't that up in here?
Up in here? What does it
And if
stand
you
for?
touch it, it's like,
Yeah.
cardiac. No, it's an angle.
It's an angle. So the A is angle.
Coastal.
Costo.
Vertebral.
Vertebral angle. Yes. So it's the right angle. So like your vertebrae is right here. Your last rib is right here. That's where your kidney sits. So you're going to go to the patient and you're going to hit them on the back with your fist.
And then they're going to hit you in the face.
Yes. And they're going to be like, oh, that hurts. You're like, well, it seems as if you have CVA tenderness, okay? But CVA tenderness can be present in renal calculi. It can also be present in pyelo, right? So you really got to rule out both, okay? I don't really give a rat's ass about this. This is a UTMB thing. Dull CV flank pain is what they call UPJ. Y'all just look. I'm not spending a lot of time on it. But if they say they have testicular or labial pain, they call it a uretero-vesico junction or something. Anyway, it's on your PowerPoint. It's just something that I'm mentioning. I've never seen it tested on anywhere outside of your school. Okay. But I just wrote it down there just in case they decided to throw it on there. Anytime you hear the word colicky pain, what does that mean? That's a stone. Yeah, okay, that's a stone. And they may have coexisting UTI symptoms, so we do have to rule that out, right? How do we know that there is a UTI? We do a UA, but definitively a culture, right? We're going to do a urine culture. But then I also need to know if they have stones, so I'm going to have to do an ultrasound or a KUB. Do you know what a KUB is?
It's the bladder.
It stands for kidney, ureter, and bladder. It's an x-ray. And it's an abdominal x-ray, right? So that will show me big stones, but it won't show me small stones, right? I can do a renal ultrasound to see what's going on in the kidneys, but I also need to see the ureters and the urethra so I can see where the stone is. So we may need to do a CT for that, right? What is a cytoscopy? Or cystoscopy. Yeah. We go up, and scopy means, or oscopy means a camera. So I stick a camera up the urethra into the bladder and see if there's something going on inside of there. Yeah?
Yeah.
Okay, what's an IVP? Cool. The IV is normal, but so intravenous. Pyelogram. It's a pyelogram. So pyelo means kidney. A gram Picture. So what we do, and it's IV, right? So we're going to do contrast IV, which means what questions do you need to ask your patient?
Are you allergic to?
Are you allergic to shellfish or iodine?
Iodine.
So then you're going to insert the contrast, and then you do serial KUB. So you're going to do a KUB, and then you're going to tell them, hey, go to lunch, come back in an hour, and then we do it again. And we're basically watching the contrast go down. So if I see like on one KUB, the contrast is here, and then I do another KUB an hour later, it's here, and then I do another KUB an hour later, and it's here. But this one didn't move. I know that's where there's some obstruction.
Okay.
Do y'all see what I mean?
Yeah.
Okay. All right, and then we're going to run some labs, obvi. Okay, we'll do a BUN, creatinine, whatever, but don't expect those always to be elevated because you don't have kidney damage, you just have a stone.
Okay.
Okay. Now, if I'm going to do a CT and I think that there's a kidney problem, I probably want to order it non-contrast if possible, right? Because contrast is hard on the kidneys. Okay. But with the IVP, you don't have a choice. You have to do contrast. All right. Okay, so I'm going to draw electrolytes, bicarb, uric acid, BUN, creatinine, and urine pH. That's looking to see what is wrong with you. Because you can see up here, I gave y'all indications of which of these types of stones usually happen in acidic urine. Okay, so if you do the urine pH and you can see it's acidic, then you can kind of be like, oh, I think this is probably what kind of stones that they have based on their history. Do you understand what I mean?
Yeah.
Okay. All right, so treatments. We're going to be like, well, damn, we found a stone. All right, so here are our options. We can watch and wait and just watch them go into labor and pass it on their own. Now, how do I know they've passed it? Well, they would feel better, but I need to strain the urine because don't I need to find out what type of stone it is so I know how to treat it. So you need to strain all of their urine, and then once you get the stone and they pass it, then you're going to send that off to the lab. Are you with?
Yeah.
They could pass it at home, right? And you would...
Sometimes they can pass it at home, but most of the time they're in so much pain, we usually will wait while they're in the hospital. Depends on how bad their pain is. If they do happen to have a coexisting UTI, then they need IV antibiotics. But if they don't, this is not an infection, so they don't need that, right?
Yeah.
Right.
What is a nephrolithotomy?
Kidney. Litho. Stone.
Uh-huh.
Take it out.
Yeah,
Go in.
they go take it out, right? So they're going to go in there and just remove the stone, right?
Yep.
Okay. Or they can be like, hey, you're having a hard time getting this stone through your ureters because they were narrowed for whatever reason, usually because of EUR or something like that, right? So they can actually go in and put in a stent in the ureters so it can make sure it stays open so that the stones can pass, okay?
Yeah.
For struvite stones, there is a medication you can take called acetohydroxamic acid. That would be the most least invasive, and it will break up the stone, okay, which would be nice to just take a medicine, okay? We could do a cystoscopy. What is a cystoscopy? We just talked about it.
Camera for
Right, so if you think that it's in the ureter, the urethra, right, we could go in and try to actually just grab it with a cystoscopy, right? Okay. Cystoscopic lithotripsy. What is a lithotripsy?
That.
We talked about this in GI, I believe.
Yeah, we did.
So, like, laser?
Like a taser.
Yeah.
Remember we talked about tasing them? Yeah. So you can actually, but this is cystoscopic or cystoscopic. So that means that you are actually going with a camera inside and tasing them from the inside. So you go in there and you find the stone and you just like tase the stone. Okay.
Okay.
Percutaneous nephrolithotomy. What does percutaneous mean?
Under the skin.
Through the skin.
kidney.
Nephrolithotomy. So nephro means kidney. Lith means
Removing the skin.
right. So that means we're going to lay the patient on their stomach. They're going to go into surgery, and then we're going to cut through the back and actually go in there and get it through their kidney. That's not preferable, right?
Yeah.
Okay. But if it's stuck in the kidney, that's the best way to go because we're not going to be able to do a cystoscopy all the way up to the kidney, right? Y'all see what I mean?
Yeah.
Okay. What's an ESWL?
That's the tasing thing.
That's the tasing thing, but that one is from the outside, right? What does ESWL stand for? Do you remember? We did this in GI and hepatic as well, so y'all should know this one.
Electro. No.
No.
Extra.
Okay. It's extracorporeal. Remember? Because what does corporeal mean?
Corporeal.
Corporeal? What is it? Like a corpse?
Oh yeah, dead.
Oh.
A bot. It means a body.
A
So
body.
corp means body. Extracorporeal means
Outside the
outside the body. And then the, so it's extracorporeal. What is the SW?
Shockwave.
Shockwave.
Lithotripsy.
Lithotripsy. Okay, remember it is outside the body. It is non-invasive. Okay. Okay. Cystolitholapsky. All right, so cyst means what? Bladder. Litho means
Stone.
a stone. Lapsky.
No clue. Lapsky.
Lapsky.
Is that X? L-A-P-X?
Lapxy.
I have no guesses. Either.
Okay. Okay, so that's going to mean like more like a drill and remove. Okay, so ostomy is just removing, right?
Yeah.
So we're going to go in through the bladder, and we're going to go in and get a hardened, like calcified bladder stone. So we're going to go in there and then pull it out. With me?
Yeah.
Fine. Okay, so for every type of kidney stones, you need massive amounts of fluid to flush out that stone, yeah?
Yeah.
Okay, like at least 3 liters of fluid a day?
Yeah.
Y'all know to strain all the urine?
Yeah.
Yeah.
They're going to need opioid analgesics because this hurts like hell.
Yeah.
Antipyretics for the,
Pain.
excuse me.
Vomiting.
Vomiting.
No.
No, that's
Antipyretics for the
Pyretics. Fever.
fever. Oh my God, y'all all dumb. Antiemetics for the
Vomiting.
vomiting. Okay. You're going to tell them to decrease their coffee, tea, and soda because what do those do to you?
Makes it look gross.
They dehydrate you, which puts you more at risk of a stone. So we're going to cut down on those and increase our water instead, okay? All right, we're going to cut down our salt because salt causes fluid retention and not fluid inside the vessels, correct? Okay, okay. They can go into shock, can they not?
They sure could,
How so?
'cause it's all blocked up.
It's all be blocked up in there.
They're not peeling,
Okay,
it's building
so
up.
all right, so where depending on where the stone is located, especially if it's inside the kidneys, right, you could go into shock. So if they all of a sudden get pale, cool skin and very low blood pressure, you better be like,
Oh no.
oh shit, exactly. That's what we say. All right, and then at the bottom, I gave you the diet and what to do for each of these stones. So the calcium oxalate stones, we're gonna lower our oxalate foods. Remember, this is what you're gonna see at like a baby shower or a tea, like a tea party, like little spinach salad. You know, they got little asparagus, tomato beet salad, little chocolates, yeah, celery and nuts. You know, they have like a little chicken salad. Y'all see what I mean? Okay. Calcium phosphate stones. Now, you never tell somebody to decrease their calcium because what's the only way you can get calcium? Intake. So if you tell them low calcium, you're just going to be completely deficient. So you just say maintain adequate calcium, the normal amount of calcium, don't overdo it, what's the normal amount of calcium per day? What are you going to recommend for this patient?
I'm guessing
Okay.
100 milligrams.
That is not even close, ma'am.
Oh, 9 to 11.
That's the level.
That's
Oh,
the
no,
level.
levels.
1,000 milligrams.
A little bit higher,
1,500.
a little bit lower.
1250.
1,200 milligrams per day. Okay. Decreasing their protein and sodium helps to prevent stones as well. Make sure you look at their multivitamins and make sure that there's not like, you know, on some multivitamins it'll say like percentage of like your recommended daily allowance of RDA and it'll be like 10,000 times the norm. We ain't doing that, okay? So you need to look at their multivitamin intake. And then manage parathyroid hormones. You do need to make sure that this patient doesn't have hyperparathyroidism, and that's the reason why we're getting stones. We don't want to treat the symptom and not the cause. Do you understand what I mean? Okay. Struvite stones, how did we get those?
That's the.
It was dirty. Yeah, that's frequent UTIs, right? So what do you want to tell them? Wash your TT and decrease your sugar intake. Yes? And y'all know all the other stuff to say, like, you know, void after intercourse, wear white cotton panties, all those kind of things. Yeah? All right. Uric acid stones. You need to go on a low uric acid diet, which is called a low purine diet. Where's uric acid located?
Located.
It's located in the red meats, right? So you need,
In the red meat.
and the red meats.
And shellfish too, right? Like
Yeah, but mostly it's going to be like game meats. Okay, so like if y'all see any kind of you know what I mean by game meats? Deer, venison, goose. Okay, sardines. That's not game. I get that. The biggest source though is going to be liver, right? Because the animal's liver is what got rid of uric acid. So all the animal's uric acid is in its liver, and then you eat its liver, so you're basically eating the animal's uric acid, but you're also getting its iron, so more power to you. All right, and then cystine stones. Remember, that's a genetic disorder that causes you not to be able to break down protein, so you have to put them on low protein diet. Do we understand renal calculi?